Thank you very much, Liz, and can I just pay tribute to you for your leadership of the as Vice Chair of your party parliamentary group and being such a consistent voice in Parliament around HIV and wider sexual health issues. So we've been asked to pose, a question's been posed to us today, is can England diagnose everyone living with HIV? Well, my answer to that is yes, we can, but that's going to require leadership, changing systems, and also additional funding to make that happen. Now, Terrence Higgins Trust was delighted to co-sponsor the Independent HIV Commission, along with our colleagues at the National AIDS Trust and the Elton John AIDS Foundation. And this is the first global independent commission that has been sponsored by charities that also got government support in advance to consider its recommendations. And we had an amazing group of commissioners, cross-party in terms of parliamentarians, but also Damien Gabriel, the former Chief Executive of Lloyd's of London, was an amazing chair of the Commission and certainly held us all to account in terms of that really important process. The Commission was supported by an expert advisory panel of clinicians, of representatives of the charitable sector, of academics, of people living with HIV. And that advisory group produced a wealth of documentation for the Commission, as well as the Commission went around the country to talk to local authorities, to commissioners, to community groups, and to people with HIV to make sure that they really understood the real issues on the ground and could really hone in on what the key issues were to end new HIV transmissions by 2030. And after a lot of thought, they came up with 20 key recommendations. And if you'd like to look at the Commission's report, do go on to hivcommission.org.uk or either any of the organisations' websites, and you will see a copy of the Commission's very detailed report and recommendations there. But one of the key recommendations was test, test, test. So we know that if we are going to end new HIV transmissions, everybody needs to know their HIV status. There are we've made lots of progress within HIV, but there are still very alarming rates of late diagnosis, particularly amongst women and Black African heterosexual men. And so whilst late diagnosis might be becoming less of a challenge for men who have sex with men, there are certain groups who are impacted by HIV where this is a really serious issue. And so the HIV Commission made a very clear recommendation that in order to make sure that we can get to a position where everybody knows their status, can get on effective treatment, and we know that once someone's on effective treatment and gets an undetectable viral load, it's impossible for them to transmit the virus to their sexual partners. That's one of the key ways that we're going to end new diagnoses. And rather than, as we do now, have a position of opt-in testing, the Commission's key recommendation that it should be opt-out testing. And so whenever anybody is in a healthcare setting and blood is drawn, it should be the starting point should be that someone is offered a HIV test. And we've seen in maternity services where that is routine, that virtually every pregnant woman has a HIV test, and we virtually eliminated mother-to-baby transmission of HIV since that happened. So that absolutely works. But we also need to normalise HIV testing in other settings as well. Our colleagues at the Elton John AIDS Foundation have an amazing project in South London, the Social Impact Bond, which is providing opt-out testing in a number of emergency departments in South London. And because of that, hundreds of people have been diagnosed with HIV who would not otherwise been diagnosed, and their health outcomes would have been much poorer because of that. Our colleagues at the National AIDS Trust have worked with a range of community organisations to focus on protocols around community testing, because we know that there are communities that testing in communities is far more effective than large-scale testing through self-testing or home sampling. So that's a really other important element. And in my own organisation, we have massively scaled up self-testing, where people test themselves at home and get the results at home. And we've been able to supply well over 50,000 self-testing kits from our charitable funds over the last 2 years. So testing is a key issue that we need to address. I'm delighted that the HIV Commission's recommendations have been so warmly endorsed by the government. And also by the other political parties, because HIV should not be a party political issue. It's an issue, it's about health and social justice. And I think for me, it's making sure that we get that cross-party consensus. That is so important. So leadership will be needed. We need to resolve issues around who funds testing, because currently, because of the complicated health and social care system, particularly in England, there are different organisations who are currently responsible for funding, and we just need to make sure there are clear protocols in place so those structures aren't barriers. And we also need to make sure that stigma is tackled as well, because one of the key challenges for people not getting tested is the fear of stigma. And I'm not going to spoil anything for Liz, but that's obviously a key element that comes into It's a Sin, as if those of you have seen it. A personal reflection from me: I was diagnosed with HIV in 1996, so almost 25 years. And when I was diagnosed, I was told I might have between 8 and 10 years left to live. And for a 31-year-old, that was like having a rug pulled from under your feet. What motivates me is that no other 31-year-old will ever have to have that conversation with a consultant. Even though we now know that somebody on effective treatment who's diagnosed today can have a normal life expectancy, it's still a shocking thing for anyone to hear. So that's what motivates me on a daily basis. Today is HIV testing week. This week is HIV testing week. It's been a remarkable week. In the first day last year, we managed to distribute 1,500 tests. This year, 8,000 tests. So we're delighted that that's happened, and the funding we received from Public Health England and the commitment from the government to make HIV testing week such a success is so important. And I know the Minister's going to say a bit about that later.